Hello dear viewers, welcome to Urban Farming. In today's video, we dive into milk-producing cows disease and management. If you're interested in urban farming ideas, please subscribe to our channel. High milk-producing cows are essential to the dairy industry, but their intense metabolic demands and genetic selection for increased milk yield make them prone to several diseases. These diseases affect their productivity, reproductive efficiency, and overall health, leading to economic losses for farmers. Proper management, including nutrition, housing, and preventive health care, is crucial to maintaining the health of high-yielding dairy cows. Some of the most common diseases affecting these cows include metabolic disorders such as ketosis, milk fever, hypocalcemia, displaced abomasum, and acidosis. Infectious diseases like mastitis, metritis, and lameness are also prevalent. The management strategies to prevent and control these diseases focus on proper nutrition, early detection, and supportive care. Ketosis is a metabolic disorder that commonly affects high-producing dairy cows, particularly in the early lactation period. It occurs when the energy demand for milk production exceeds the energy intake from feed, causing the cow to mobilize excessive body fat reserves. This leads to the accumulation of ketone bodies in the bloodstream, resulting in symptoms such as reduced appetite, weight loss, decreased milk production, and lethargy. In severe cases, neurological signs like abnormal behavior and difficulty standing may occur. Managing ketosis involves ensuring a well-balanced diet with adequate energy levels, particularly through the inclusion of high-quality forages and concentrates. Feeding cows a controlled energy diet during the dry period and supplementing with propylene glycol or niacin can help prevent ketosis. Regular body condition scoring and early detection of ketosis through blood or urine tests enable timely intervention, reducing the severity of the disease and minimizing production losses. Milk fever, or hypocalcemia, is another common metabolic disorder affecting high-yielding dairy cows, especially around calving. This disease is caused by a sudden drop in blood calcium levels due to the high demand for calcium for colostrum production. Cows with milk fever exhibit symptoms such as muscle weakness, loss of appetite, cold ears, and an inability to stand. If left untreated, the condition can progress to coma and death. Preventing milk fever involves proper dietary management during the dry period. Feeding a negative dietary cation-anion difference (DCAD) diet helps improve calcium mobilization from bones and enhances calcium absorption from the intestines. Administering oral or injectable calcium supplements immediately after calving can also help prevent the onset of milk fever. Proper monitoring of high-risk cows, particularly older and high-producing animals, ensures timely treatment and reduces complications associated with hypocalcemia. In the abomasum, the fourth stomach compartment, shifts from its normal position due to factors such as excessive fat mobilization, reduced rumen fill, and changes in digestive motility. Left-sided displacement, LDA, and right-sided displacement, RDA, are the two main forms, with LDA being more common. Affected cows show symptoms such as decreased appetite, reduced milk production, mild colic, and a characteristic pinging sound upon auscultation of the abdomen. Managing displaced abomasum involves providing adequate fiber in the diet, encouraging dry matter intake postpartum, and minimizing excessive body condition loss. Ensuring proper feed bunk management, avoiding sudden dietary changes, and promoting regular exercise can reduce the risk of displacement. Surgical correction may be necessary for severely affected cows, followed by supportive care to restore normal digestive function. Acidosis is another major metabolic disorder affecting high milk-producing cows, primarily caused by excessive consumption of rapidly fermentable carbohydrates and inadequate fiber intake. The condition leads to an overproduction of lactic acid in the rumen, reducing pH levels and causing ruminal dysfunction. Cows suffering from acidosis may show signs of reduced feed intake, diarrhea, decreased milk fat percentage, and laminitis. Severe cases can lead to systemic inflammation, liver abscesses, and even death. Preventing acidosis involves feeding a balanced diet with sufficient physically effective fiber to promote proper rumination and saliva production, which helps buffer rumen pH. Gradual dietary transitions, maintaining a consistent feeding schedule, and using feed additives like buffers, e.g., sodium bicarbonate, can help mitigate the risk of acidosis. Regular monitoring of rumen health and early intervention are crucial to maintaining optimal digestive function and milk production. Mastitis is a significant infectious disease affecting high-producing dairy cows, leading to inflammation of the udder and reduced milk quality. It is caused by bacterial infections, including Staphylococcus aureus, Streptococcus agalactiae, and Escherichia coli, which enter the udder through the teat canal. Mastitis can be clinical, presenting with visible signs such as swollen and painful udders, abnormal milk, and fever, or subclinical, where no visible symptoms are present but milk production declines. Managing mastitis involves implementing strict milking hygiene, including proper teat disinfection and the use of individual towels for each cow. Maintaining a clean and dry housing. Regular milk testing, such as somatic cell count, SCC, monitoring, helps detect subclinical infections early. Prompt treatment with antibiotics and the use of dry cow therapy at drying off can effectively control mastitis. Vaccination against common mastitis pathogens also plays a role in reducing disease incidence. Metritis is a uterine infection that commonly affects high-yielding dairy cows after calving. It occurs due to bacterial contamination of the uterus, often following a difficult calving, retained placenta, or unhygienic calving conditions. Cows with metritis exhibit signs such as fever, foul-smelling vaginal discharge, reduced appetite, and decreased milk production. If left untreated, the infection can lead to systemic illness and infertility. Preventing metritis involves maintaining proper calving hygiene, ensuring timely removal of retained placentas, and providing postpartum nutritional support to enhance immune function. Early detection and treatment with antibiotics help control the infection and prevent complications. Proper reproductive management, including routine veterinary checks and monitoring of uterine health, aids in reducing the incidence of metritis and improving reproductive efficiency in high-producing cows. Lameness is another major health concern in high-yielding dairy cows, affecting their mobility, milk production, and overall well-being. It can result from multiple factors, including hoof overgrowth, foot infections, and metabolic disorders such as acidosis. Common causes of lameness include digital dermatitis, sole ulcers, and white line disease. Affected cows exhibit signs such as reluctance to walk, uneven weight distribution, and reduced feed intake. Managing lameness involves regular hoof trimming, providing comfortable flooring, and ensuring proper nutrition to support hoof health. Maintaining clean and dry housing conditions reduces the risk of infectious hoof diseases. The use of foot baths with disinfectants like copper sulfate or formalin helps control bacterial infections. Prompt treatment of lame cows, including pain management and corrective trimming, improves recovery and minimizes production losses. Proper management of high milk-producing cows is essential to prevent and control these diseases effectively. Nutrition plays a critical role in maintaining health and productivity. Providing a well-balanced diet with adequate energy, protein, fiber, vitamins, and minerals helps meet the metabolic demands of high-producing cows. Feeding strategies such as total mixed rations, TMR, ensure consistent nutrient intake and prevent metabolic disorders. Ensuring proper dry cow nutrition, including controlled energy diets and appropriate mineral supplementation, reduces the risk of transition diseases like milk fever and ketosis. Regular monitoring of body condition score, BCS, and adjusting feed intake accordingly helps prevent excessive weight loss or gain, which can predispose cows to various health issues. Housing and environmental management are equally important in disease prevention. Providing well-ventilated, clean, and dry housing reduces the risk of infections such as mastitis and metritis. Proper cow comfort, including adequate space, soft bedding, and appropriate stocking density, minimizes stress and promotes optimal health. Regular manure removal and maintaining clean feeding areas reduce bacterial contamination and improve overall hygiene. Proper ventilation helps control humidity and prevents respiratory diseases, which can impact milk production and cow well-being. Routine health monitoring and preventive healthcare practices are essential in managing high milk-producing cows. Regular veterinary checkups, vaccination programs, and parasite control measures help maintain overall herd health. Early disease detection through regular observation and diagnostic tests allows for timely intervention and reduces the impact of diseases on productivity. Implementing a comprehensive herd health program, including mastitis control, reproductive management, and foot care, ensures long-term sustainability in dairy farming. Milking management is another critical aspect of disease prevention. Proper milking procedures, including pre-milking teat disinfection, gentle handling, and post-milking teat dipping, reduce the risk of mastitis. Maintaining well-functioning milking equipment and ensuring proper vacuum levels prevent teat injuries and bacterial contamination. Culling chronically infected cows helps improve overall herd health and milk quality. Stress management is vital for maintaining the health of high-yielding cows. Minimizing stress factors such as overcrowding, sudden dietary changes, and excessive handling reduces the risk of metabolic and infectious diseases. Providing access to fresh water, maintaining a consistent feeding schedule, and ensuring proper cow grouping based on production levels help optimize performance and health. High milk-producing cows are susceptible to various metabolic and infectious diseases due to their intense production demands. Effective management strategies, including proper nutrition, housing, health monitoring, and milking hygiene, play a crucial role in disease prevention and control. Early detection and prompt treatment of diseases minimize production losses and improve overall cow welfare. By implementing best management practices, dairy farmers can enhance the longevity, productivity, and well-being of high-yielding dairy cows, ensuring sustainable and profitable dairy farming. That was for today. Thank you for spending your time with us. Please don't forget to subscribe.